Hello everyone, my name is Vey and I'm a pharmacist at Lim's Pharmacy. Thank you for tuning in to another episode of SK Health Time. In the second episode of the diabetes series, we'll be focusing on the different types of diabetes because you may have heard, there are different types of that exist. So we'll cover that briefly, and then we'll talk about type 2 diabetes, which is the main one that's very common in our community. So the first type of diabetes is called type 1 diabetes. That one is when there is no there's an unknown cause for it. It can be an autoimmune disease, so it can occur in very young age. So that is when the pancreas is not producing enough insulin. So as you can remember from our last episode, insulin produced from the pancreas help the body to absorb the sugar into the cells and muscles. Without the insulin, the sugar, it remains in the bloodstream, and that can cause damaging effects. So the treatment for type 1 diabetes is an insulin treatment. The next type of diabetes is gestational diabetes. So this diabetes is common in it occurs in pregnancy. So as you have the baby, your blood sugar can go up, and the way your body metabolizes the sugar or break down the sugar is not the same as when you are not pregnant. Most people, the gestational diabetes will go away after giving birth. However, we should regularly check up because having gestational diabetes actually puts you at a higher risk of getting type 2 diabetes later on. So anyone that has a gestational diabetes previously and haven't been checked up in the last year, we can also go through with you and calculate what your risk of getting diabetes as well. The next type of diabetes is type 2 diabetes. This one is the most common form of diabetes, and what we'll be mainly focusing on in this series, because this is more due to our lifestyle, and it's a type of diabetes that we can prevent. So it's not something that we are born with, it's actually our lifestyle that's causing it. So type 2 diabetes is like what we mentioned in the previous episode, is when the pancreas is producing insulin, but then insulin is not working as well. So that means the sugar that we eat, it doesn't get absorbed well into our cells, so it stays sitting in the bloodstream. And this is very dangerous because you can imagine if the blood vessel is very tiny, your blood vessels has blood in it, has sugars, it has cholesterol, it has so many other things in it. If there's so much sugar in it, it's going to block up all the small blood vessels, especially in the tiny blood vessels in the eyes, on the ends of your fingers and toes. You can imagine how tiny they are, and especially in the kidneys. So if those blood vessels get blocked, that causes a lot of damaging effects, like all your eyes, your kidneys won't function as well. So that's why type 2 diabetes is very, very dangerous. And type 2 diabetes is mainly caused from the lifestyle that I mentioned earlier that we have. So it's due to being overweight. It's due to the food that we eat. We're eating too much sugar, too much salt, too much fatty foods, too much processed food, and alcohol can cause it as well. Smoking, it can affect the way our body metabolizes the sugar, and not eating enough fruit or vegetables, which contribute, has all the vitamins to give us a strong immune system to fight and make our body function well. And also having a not active lifestyle as well. We are, we're driving more. We're not walking as much as we used to. We're sitting down watching TV. We're having too much technology now, like the phone, the computer, and so on. So our lifestyle is a lot more not as active as before. So all this contribute to the way our body function, and it can lead to type 2 diabetes. So once again, if you think that you may be at risk or you're not sure, you want to check it. If you are between 35 and 74 years old and you haven't had diabetes screening in the last 12 months, please come in. We can help you. We can check if you're at risk of diabetes or not. It doesn't matter if you're skinny, you're fit, you think you're fit. Anyone is at risk of diabetes. So just come in and see us. Next episode we'll focus on what's the sign and symptoms of diabetes is. So tune into next episode. Thank you.